9 symptoms of heart disease that we ignore. Hello everyone and welcome to this educational video about 9 different symptoms of heart disease. Heart disease is a serious condition that affects millions of people around the world and can lead to serious health complications if not diagnosed and treated early. This video will go over the 9 most common symptoms of heart disease so that you can be aware and alert of any potential risks. Before we begin, it's important to note that there is no single symptoms that is always an indication of heart disease. Many of these symptoms could also be due to other medical conditions and should be checked with a doctor to be sure. Additionally, some people may experience some of these symptoms and not have heart disease at all. It is undeniable truth that many heart conditions can be attributed to an unhealthy diet, a lack of physical activity, environmental toxins, and smoking, among other issues. One of the key reasons this health issue is responsible for so many fatalities globally is because people are unaware of the warning signs and delay seeking medical assistance. Many of the indications of heart issues are not intense and can be mistaken for symptoms of other medical conditions. Being educated about the signs of heart disease can be paramount in preserving life. Therefore, it is important to be aware of the 9 warning signs of heart disease that should not be overlooked. Number 1. Dizziness and shortness of breath. The research conducted by the National Institutes of Health found that feeling dizzy and having difficulty breathing can be signs of a heart attack. These symptoms can lead to fainting and suggest that something is wrong with the heart's rhythm. If you have this kind of dizziness and shortness of breath for over a period of time, it's time for you to consult your doctor and discuss about your health condition. Number 2. Fatigue. This condition is especially common in women and can happen right before, during, or shortly after a heart attack. According to the Mayo Clinic, feeling almost constantly fatigued can be an indication of cardiac issue. Of course, this could potentially point to another health issue, so it is best to talk to your doctor for a correct diagnosis. Number 3. Nausea or lack of appetite. It has been found by the National Heart, Lung and Blood Institute of United States that many individuals can experience nausea and vomiting just prior to having a heart attack. Additionally, an indication like abdominal bloating, which is related to heart failure, can affect one's appetite too. Talk to your medical professional if you face these kinds of symptoms often. Number 4. Chest pain. Typically, chest pain is associated with a heart attack. However, this is not always the case. According to Dean Jean C. McSweeney, a research associate from the University of Arkansas School of Nursing Medical Sciences, chest pain is typically the first symptom that people look for. The chest pain can range from a moment to a few minutes, which is associated with a shortness of breath, difficulty in breathing, pain in the left side of the chest, pain in one or both the sides of the arm and neck. Number 5. Pain in other parts of the body. Chest discomfort is the most typical symptom of a heart attack. This discomfort can extend beyond the chest to the shoulder, arms, elbows, back, neck, jaw, or stomach. Interestingly, sometimes the chest pain may not be present, but the other areas of the body still experience the pain. Number 6. Skipping a beat or pulse. Occasional fluctuations in your pulse rate may be considered normal. However, if you experience symptoms such as dizziness, weakness, or breathlessness, it could be a sign of heart attack, heart failure, or an arrhythmia. This is suggested by a study from the University of Arkansas, which states that one of the most important examinations done in case of a suspect abnormalities is a pulse rate check. Number 7. Sweating. Sweating profusely while in a relaxed state can be a warning signs of an impending heart attack, according to the research done by the U.S. National Library of Medicine. This symptom typically happens before the attack takes place. Number 8. Inflammation. The University of United States conducted a study that verified that if a person is suffering from the heart failure, it can result in fluid buildup in the parts of the body such as feet, ankle, legs, and abdomen. Number 9. Pale skin color. Many people appear to be pale or gray in complexion prior to having a heart attack. Because blood pressure can fail drastically, the individual may seem to look very unwell. However, this could also be a symptom of anemia or other health issues. It is advised to seek medical attention if someone is seen in this state, as it is a wise decision. As you can see, there are various symptoms of heart disease that can be quite serious. It is important to be aware of these symptoms and to see a doctor if you are experiencing any of them. I hope this video been helpful in providing information about the 9 most common symptoms of heart disease. Until next time, stay informed and stay healthy.